lot of germs on this piece of paper, or a chart or a notebook that a lot of people touch, it could be on there, all right? So I want you to keep that in mind. We can turn the lights back up. I want you to keep that in mind as we proceed forward, okay? So how do you stop the spread of infection? Well, one of the first things we have to understand is how infections happen. And part of that is the chain of infection. Oh, sorry. Excuse me. So let's talk about these different links. For an infection to spread, all of these links have to be in place. So if we can break one link of that chain, we'll stop the infection from spreading, all right? So let's take a look at these real quick. So first you have your infectious agent. That's going to be the germ. So viruses, bacteria. C. diff is a Clostridium difficile, is a bacteria that is in the form of a spore. And so it spreads by contact. It causes an inflammation of the colon, and people can get really, really sick from that. We actually have one case on station 3 right now of that. So they have to be in isolation. I'll talk about that later. The reservoir is the place the infection agent lives. So just like I showed you with the paper, it can live on that, it can live on us, of course, but lots of inanimate places like doorknobs, light switches. Who touches their light switches and cleans those in their houses on a regular basis? I do when they look dirty, right? Okay, or phones. Now, who has a smartphone in here? Okay, pull out your phone. Take a look at the front of your phone, okay? There's about 25,000 germs for every square inch of your phone. That's on there. Amy's like, oh.
Yeah.
Okay, so, but how often do we clean our phones, you know, because it's in and out of our pockets, we set it on tables. The germs are everywhere, and you can't avoid them. There's no doubt about that. And if you wanted to try to, it would be a full-time job all day, right? So none of us have that kind of time. So what we need to do is look at what things can we do to minimize the spread of infection, the spread of germs. So first you have a portal of exit. That's the next link. So it's an escape vehicle. It could be excretions, secretions, droplets, like I talked about, skin contact. You know, if you have a skin cut, or like a paper cut, and then you shake hands with somebody who's got influenza germs on them, that's how it gets in, okay? But we have to have that escape vehicle. The next is the mode of transportation. That's the way the agent is carried to the next host. So it could be bloodborne, where you have contact with someone's blood with yours, airborne, droplet, and then vector-borne. An example of vector-borne are mosquitoes that spread West Nile, for example, and getting bit by that. So that's the kind of things we see as far as carrying to the next host. We can also see it indirectly through food, water, other contaminated items that you see below there. In fact, one piece of trivia I thought was interesting, I never knew this, but the average sneeze travels at about 100 miles an hour. Okay, we have that much force behind a sneeze. Okay, so with that, you know, there's a lot of publicity out there about what's the best way to sneeze, right? So, and I saw Amy at the beginning, you know, sneezing into her elbow, into her clothes. Kleenex tissue. In fact, the CDC still says it's okay to use a Kleenex tissue. And of course, the bare hands, okay? Which was like my kids when they were young, of course. So I want to watch another video, but this way I have to turn all the lights off, Angie, because I want you to see, be able to see the colors in this, okay? It's got a little commercial, sorry. Oh, stop moving, honey.
Hey, Ryan.
Hey, Greg.
Listen, it's becoming a little bit of a problem that you aren't.
Now we're going to be testing some techniques for stopping sneezes from spreading their wares, their germs, their bacteria, and that's what this rig is set up to test. Jamie and I will wear white suits, like I'm wearing now, and stand here at the apex, and we will sneeze. And of course, our mouths will be filled with colored liquid like before. We're going to try and prevent the spread of that sneeze with 3 different methods. 1, open hand. Hat-two. 2, into the elbow. Hat-two. And 3, something no gentleman should be without, a handkerchief. Hat-two. We're going to be looking at our suits and on the floor to see which one works the best. Sneezing into the open hand. I'm predicting this is going to be kind of a horror show. A swig and a sniff later. That's 1. Yeah. Others know what's coming. For each style, they're going to unleash a sample of 3 sneezes. Oh, it looks horrible, doesn't it? I look like a vampire. Ah.
Adam's face is a picture, but it's the canvas that tells the real story.
I see spots up to 8 feet away, dude.
Yeah, it did spread quite a lot, but there's a lot of markings here. So I'd say single hand, not so good.
Yeah, not so good.
Not so good, and then some. Even with his hand directly in front of the oncoming sneeze, Adam can't begin to contain the explosion.
Now, I'm pretty clear that sneezing into your hand is meant as a courtesy to those around you to keep from spreading your germs on them. And as far as I can see, it's quite effective at doing exactly the opposite. I noticed there's almost no red dye on me at all, and crap loads all around me. If I was on a subway, I'm Typhoid Mary.
With the hand getting the thumbs down, can the elbow do any better? To find out, it's over to Jamie, and he'll be sneezing in green.
Now, we wait for the sneeze to take effect on Jamie's whoosh your nose. Slowly, it irritates the cilia inside.
And with the cilia salivating, 3 sneezes later, and the results are very impressive.
Yeah, I see only 2 droplets and 1 on your shoe, and let's look at your elbow here. That's totally localized to you, man.
And you know what? It's all on my arm and not on my hand, so I'm not as likely to spread it around.
Yeah, doubly effective.
Hands down, the elbow is a highly effective technique, with virtually the entire sneeze contained on each of Jamie's sneezes. But can the humble hanky do better still? Well, it's back to Adam, and for this final test, he's sneezing in flu.
How did we do? I see a tiny dot of blue there.
At first, it seems like the hanky may be victorious, until...
I see some on the hanky.
And look, it's penetrated all the way to both sides.
It's penetrated both sides, and perhaps most damningly, it's on my hands, ready to spread to the next person whose hand I shake.
The sneeze seeped through the hanky, contaminating Adam's hand, making it a pretty poor technique. And it gets worse.
Let me make one more thing clear about this hanky I'm holding here. Imagine, achoo, you sneezing it all day long. You keep on putting it in your pocket, pulling it back out, giving people change from your pocket, handing them your pen, handing them your phone, talking on your phone, spreading germs. Yeah, it's not just a Rorschach test, it's a petri dish.
Although the droplets were contained, the hand exposure means the hanky has hit the skids.
So, this flu season, which method are you going to use? The hand? The elbow?
It's gotta be the elbow.
I totally agree, it's the elbow.
So now you know.
Coming out.
I think I get pretty strange.
All right, so any surprises there? No, but it is interesting, I think, to look at their face. When he used by himself, did you notice all the red along his face versus the Kleenex and like the hanky? When he used that, it was really localized, like just right here. So was the arm. And so I don't think people think a lot about what lands on their face when they sneeze. Kleenexes, you know, I'm guilty of this. I'll use a Kleenex. I'm like, oh, I can use that one more time. And I put that in my pocket. So it's the same kind of concept. So sneeze into your elbow. It's the best way to go. All right, the next link is the portal of entry. This is the open door, all right? So I talked about the cut, mucous membranes. Somebody, you know, we talked about kids getting crazy. You're really entertaining me here. That's right. What is the biggest pastime is people drive in traffic? Picking their nose, okay? Just telling you. Okay. Then the next link is the susceptible host. So this is the portal of entry of the body, okay? So when we think about our population with geriatric residents, as we age, our immunosuppression, our ability to fight infection goes way down. People who are diabetic, individuals that have had surgery that come back to us, they're at risk for high infection, or high risk for infection. And then, malnutrition, weakness, that's our population. Now, what research has found about staff and employees is that those who get infections tend to not get enough sleep and not eat well. So, gosh, that doesn't talk about our lives at all. All right. And then we complete the chain by we infect somebody else. We shake their hand, whatever the case may be, okay? So how do we break the chain? Well, there's ways to break the chain. So we're going to talk about that to help keep that infection from spreading. And that is a lot of things that we can do, both for the residents we care for and for ourselves. So I'm going to address both of those things. So first, we got to stop the bugs. That's our first link in the chain. How do we do that? So washing hands, of course, you're going to hear me talk a lot about that. Disinfecting, how we handle linen, following standard precautions, and then putting hazardous waste in those red bags, and doing that at the point of use. Let's talk about hand hygiene first. I think we all know if your hands look dirty, you're going to wash them, right? All right? But I think sometimes we have to think about, you're so good at that, Amy. I want you to model. There you go. It's good. No, I'm sorry. I'm picking on you. Before we perform a clean task, aseptic means clean. So if we have to deal with a wound dressing change versus cutting up some raw meat or whatever, we need to wash our hands before we do that, okay? Blend bodily fluids, of course, when we are removing our personal protective equipment, after the restroom, of course, and then really the research shows we should be washing our hands before and after meals, not just after, not just before, okay? I know I'm guilty of that one. I don't do a good job of washing before I eat, or at least using some hand gel, okay? So how to wash, all right? So I know that we've done a lot to talk about. You wet your hands, you apply your soap, but there's two things that are very critical here. And what are those? What? Length of time, 20 seconds. I know that feels like forever when you're washing your hands, but that's how long it takes to get the germs off of your skin. And what's the other thing?
Shutting off the water with a clean paper.
Well, that's gonna come. There's one more thing too. Let me give you a clue.
Friction.
What? Thank you. Friction. It used to be like when I was growing up, that water had to be hot and with soap, and that's what got it off. It was a hot water. Well, we know that's not true anymore. It's friction. So it's really important that we are using friction to clean. I'm going to show you another graphic here. If you look at this one, anything in red is typically where people miss when they wash their hands. Okay, so in between the fingers, because most people don't do this when they wash their hands. I'm going to encourage you to do that so you get in between your fingers, all right? On top of your nail, not your nails, but on your nail bed, and making sure you're getting those too, as well as the thumbs. People miss the thumbs a lot, all right? Because maybe you're doing this, but you just don't catch that thumb. So keep those areas in mind, because those are the critical areas that we miss. So what about hand sanitizer? We have a lot of that in the building, which is great. It's really great because research shows that alcohol-based hand sanitizer actually kills bacteria better than hand washing, all right? Now, the exception to that, though, is C. diff. C. diff, alcohol will not kill C. diff. It has to be hand washing. So if we're ever working with a resident who has C. diff, we have to wash our hands, okay? Alcohol-based hand sanitizer have to have at least 60% alcohol to be effective. So all the products we use in this building have 60%. Now you can go to a lot of stores and get like really fun little hand sanitizers. Like this one's from Bath & Body Works called Raspberry Meringue. Smells really good, really good. On the average, do you think that these guys have greater than 60%? They don't. However, I'm not trying to sell stuff for Bath & Body Works, but this one has 68% in it. So here's the clue to you. If you are buying hand sanitizer, look at the label on the back. It should tell you how much alcohol is in it. If it does not, don't buy it, because it does not have enough alcohol in it. All right, at least 60%. Okay, and we also need to make sure that we're using hand sanitizer like we would when washing hands. So our sanitizer, our automatic dispensers, they give you enough to get your hands totally wet. So you got to do the same thing. You got to get in between your fingers. You got to make sure you get those thumbs, get those nail beds, until they're dry. It takes about 15 to 20 seconds to do that. The other thing is hand sanitizer, they say, can be used 3 times and then you need to wash your hands. For me, my goal at this point is if I can get everyone to use at least hand sanitizer when they're dealing with, if it's appropriate to use hand sanitizer, that's what I want to see happen. That's what I want to see happen. Especially if we're serving trays, for example, in the dining room to our residents. one of the things that we ask all staff to do is make sure you use hand sanitizer in between each resident when you're serving. Because here's what happens, so, and I think a lot of you know my brother lives here. And so I sit down with dinner with him, and so I just watch and just kind of see what happens. And so I'm gonna serve a tray to Angie, so I come over here and give her a tray, and then I'm walking back and I go, like this, flick my hair a little, and then I go get another tray and give it to Ann, and then I might, oh God, my face itches. So I'm touching myself all over the place. I see it all the time. Do I see people consistently using hand sanitizer in between? No. So we need to really reinforce that we're doing that, because touching here, we have probably on average between 25 to 50 microorganisms living on our skin at all times. Okay, that's not very many really, and that's normal. That's normal, but we pick up more throughout the day if we're not going to clean our hands. Okay? So let's talk about cleaning. That's the next thing I want to talk about. This is another way to break that link. There is a difference between cleaning and disinfecting. Who can tell me what cleaning is? Besides Amy. What's cleaning? So anybody ever take like a wet rag and just wipe those breadcrumbs off that counter? Okay, like at home, my husband will get a wet paper towel and he'll just wipe that stuff off and just roll it on the floor. No, he doesn't do that. But he uses a paper cloth. That's cleaning. Disinfecting means we're using a chemical to kill the microorganisms that are on those surfaces, all right? So I think we need to get in the mind frame that we're disinfecting in this kind of environment. Our green top wipes we just switched to kill over 100 microorganisms. That's pretty impressive. Our purple top wipes we just had only killed 68. All right, so we made a big step up in that and killing more infectious bugs. Okay. The other thing to keep in mind is that certain pathogens can live on surfaces for quite a long time. So C. diff, I know I bring that one up because it's just because it's very contagious. Up to 5 months if we don't do a lot of disinfecting. Now, housekeeping has a protocol they follow when we have a C. diff situation, so that we make sure that high-touch areas are being cleaned. They even clean the doors, because those spores, like I said, can hang out, and you can't see them. They'll hang out for quite a while. Hepatitis B virus, up to a week. All right, now our green top wipes, they kill hepatitis B, so we want that. And then, of course, influenza, 8 hours. So think about that in a given work day. If you're working 8 hours, that there could be influenza virus somewhere. If we haven't done something along the way to disinfect ourselves or our environment, then we may spread it. Linen handling, and I know you guys have heard this all before, but when it comes to linen, it's really important that when we get linen that we carry it away from our body. And for the simple fact that by the time we're doing anything, even when we step into the door, we're getting a lot of stuff on our clothing, on our scrubs, so we need to hold it away from our body. We need to use PP always when we're handling infectious linens. So again, if we're in a room where someone has influenza, we need to bag that stuff right in the room, because we could give that to somebody else if we put it with other laundry. And then lastly, not to sort or pre-rinse anything in resident care areas. I bring this up because I've seen this happen in dirty utility rooms, and that's actually considered part of our resident care area. So any kind of sorting or pre-rinse needs to happen in the laundry area downstairs. This is something I see all the time as well. All right, so here's our linen carts of clean linen. And so many times I see that mesh screen is way up on top. In fact, just the other day I was in the clean utility room, and someone had put the mesh screen up there and then put a pillow on top of it so it wouldn't fall down. Okay, to keep it up there. But what happens? Why, again, linen, clothing, we can carry that to people's rooms. So how does that happen? Because some people think, oh, that doesn't make a difference. How does it make a difference? Anybody? Or what happens when you walk in sometimes?
We can spread the bacteria or microorganism toward the clean linen.
Say that again, Em.
It's been like we pretty much like would spray the bacteria or the dirty thing to the clean linen.
Right, exactly, yeah. Or we walk by and brush against it. I know I've done that because there's 3 people in there trying to maneuver in this space about this big. So I've rubbed against it. That's another reason as well. A lot of different things. We got stuff in the air flying around, especially during the influenza season. That mesh netting actually helps minimize that the degree to which that happens. So it's really critical that we keep that mesh screen down. I will tell you that state surveyors will be looking for this, that we make sure we're always keeping our clean linen covered. Okay. Personal protective equipment. All right. So I think a lot of you know what that is. We're talking about gloves, gowns, masks. Face masks, respirators. We don't see that a lot in healthcare, other than maybe our maintenance folks have to use one because there's so many fumes for something they're doing. But those are pretty standard items, and we always have that stocked in our building for that reason. So the research says, or shows from the CDC, that people are pretty good about how to put it on. You know, they put everything on like in that order, and they put their gloves on last. But they don't do so well on taking it off, because they end up contaminating themselves. So a lot what happens, the situation that happens is they take their gloves off, and then they do this and pull off their gown. And so now they just infected themselves. Or they have their gloves on yet, they want to take their gown off, so they reach back here and untie. And so that results in contamination as well, all right? So what I teach those in orientation, when we talk about PPE, I teach them just to make a loop so it's not real tight. So that way they can actually get their gown off first, and they can just pull it, it'll come, and then they can roll that up in a ball and take their gloves with it if they want, or they can take those off after. And then goggles can be taken off in the back of the head, masks behind the ears, you can pull those strings forward, okay? So those are the things to think about, is making sure, being conscientious if you're wearing it, of how to take it off properly. The other thing to do is that when it comes to PPE, so I'm going to talk about gloves here for a minute, is we should make sure we're always changing gloves when we go from a dirty action to a clean action, all right? Or we're dealing with two different, I'm going to use the example in dietary, like if you're cutting up vegetables, but now you got to switch to raw meat, you should be either switching gloves or washing hands, whatever you may do. I know that usually they wear gloves. So, but that should be a change, because you could contaminate each other, especially if you start with the raw meat and then go to the vegetables, you could contaminate yourself. For nursing, the example there is, nurses can dispense barrier cream to the CNAs to put on someone's bottom, as if a doctor ordered that, for example. So if the CNA is clean, I'm going to pick on Am. If Am's cleaning up, as if she would ever do this, is cleaning up someone, doesn't clean her hand, or doesn't change her gloves, and takes that barrier cream and puts it on, well, now she just put poop right back on their bottom, okay? So, and believe it or not, it happens more often than we think, because we don't think about it, that's all it is. So, all PPE should be removed and discarded within the room they were worn, all right? So we want to make sure that's bundled up at the point of use. And then, of course, always washing hands before and after applying gloves. So when should you wear gloves? And this has got a lot of great information in it, but what I really want to focus on is the potential. If there is a potential that you might be exposed to either something with bodily fluids, or something that may be infectious that you're concerned about, or that it may happen to be that way, then put gloves on. You know what? I don't think Amy's going to care if we use a few extra gloves in the building to keep you safe. We want you to keep yourself safe with that and keep our residents safe. And I'll give you a good example. This last Monday, a nurse from Station 5 asked me to come up and ask her and help her draw blood. And she wanted to get better at it, and she just wanted somebody to kind of talk her through it. So I put gloves on, because even though I wasn't drawing the blood, she may need my help. And if I don't have gloves on, then I can't help her. Well, sure enough, the guy's a bleeder, so I had to hold pressure. That's why. So the potential was there. So think about that when you're doing your work throughout the day. Do you have potential that you might be exposed to something? We talked a lot about direct patient contact, and then indirect exposure. So emptying emesis spaces or urinals. With my brother, he uses a urinal in his room, and so I go in there and I visit with him, and I have had an occasion or two where a CNA will come in and dump that without putting gloves on. Okay, so we need to think about that too. That those can easily we can expose ourselves to things. Handling waste or cleaning up spills. Okay, any questions about that so far, or observations? Or, wow, we need to do that better. Or, no, we're doing that, so yay, celebrate me, okay? All right, let's move on to standard precautions. So, of course, hand hygiene. Again, we're going to talk about that forever. PPE, we talked about that. The other thing is proper handling and cleaning of equipment and instruments or devices we use throughout our day. So my challenge for this, for example, is how often do we clean blood pressure cuffs? Because we use those for every single resident. How often do we clean those? How often do we clean equipment that goes in and out of residents' rooms? From maintenance to dietary to whoever we're working with. How often do we do that? anything that's shared needs to be cleaned between residents, all right, or cleaned on a regular basis. And I should switch my language. Even I have to switch my language. We need to disinfect it, not just clean it, but disinfect it. The other thing is we need to make sure we're using barriers. So if we have to put something on the floor, maybe maintenance is in there and they're having to repair something, we need to put a barrier on that floor then, so whether that's a towel or cardboard, like when you guys, I'm picking on you guys now. So, when you go in and you have to repair something, a lot of times I've seen you put cardboard down or whatever the case may be, if that makes it safer, or covering up cords, those kind of things. So, the best thing you can do when it comes to standard precautions is to assume all surfaces are contaminated. And I feel like when I say these things, I sound like doomsday, that, we're all gonna get, like he said in the video, Typhoid Mary. But that's not the case. It's just trying to raise our awareness and our attention to being more diligent about this. Now I want to turn the tables a little bit and talk about us as employees, all right? So my whole adult life, I've heard, and I'm sure a lot of you have heard too, well, if you don't want to get sick, don't hang around sick people, right? Okay? But we're in healthcare, and so sometimes we feel like we can't miss work because there's nobody else to do our work, so we come to work. We want you to stay home if you're sick. If you're having vomiting or diarrhea or fever and respiratory symptoms, we want you to stay home. And that's really, really hard for nursing staff, CNAs alike, because we feel like we're abandoning our residents, and nurses as well, because that's pretty much what we're taught, is that you need to come to work unless you're dying, okay? We don't want you to pass that on, all right? There have been many, many, many cases that have been studied where influenza has been spread because of healthcare workers, because they didn't stay home and they had influenza, okay? So if you aren't feeling well, you can come to work, but let's say you just have a nasty cold or whatever the case may be, we want to make sure you're wearing a mask, okay? You don't want to be able to infect anybody else, and you want to protect yourself from any further germs, because when you have a cold, your immune system is decreased, so you could even catch more things. You could maybe start with a cold and then develop bacterial bronchitis, so it could get worse, so you want to make sure you protect yourself. The one thing I'm going to ask you to do, though, is if you're wearing a mask, that you wear that throughout your shift. Here's what I see happen. So just last week, when I was working, I came out and I saw one of our staff with a mask on, which was great, and she went to sit down at the nurse's station, and then she took it off at the nurse's station, put it down, and then hey, that was a good work up to my thinking. So it gets worse. And then she sneezed, and she sneezed right in her hands, and it got all over the computer because it's right. So I sat down and talked to her a little bit, and she's like, well, I'm not taking care of residents, so I don't really need to wear it. I'm like, yeah, but you need to wear it for your coworkers, okay? So I asked her to clean the computer, okay, and to make sure she wears that and she's taking breaks, okay? Clean your hands, and of course, avoid touching your eyes, your nose, and your mouth. How many times an hour do you think we touch our face? Anybody know? Guesses? Too many. I've heard that every time so far. 25 times. 25 times an hour we touch our face, because we don't think about it. So we have an itch, maybe our eye, it's like, something's in my eye. Maybe we're sitting at the desk and we're working on something, so we're like this. We're just we just don't know we're doing it, So just bring that awareness to, like, oh yeah, we do touch our face a lot. So let's move on to transmission-based precautions. All right. First, I'm going to talk about contact precautions. So contact precautions are the case where we have something that is spread by touch, okay, or on inanimate objects, whatever the case may be, such as C. diff. That's a contact precaution situation. So we have to wear gowns and gloves anytime we enter that room. Housekeeping, like I said, they have a protocol they work with, and we really have to focus on cleaning those high-touch areas. Now, they do a great job of cleaning, like, light switches. How many of us clean our light switches at home? Doorknobs, those kind of things. But one of the things that they don't really clean, because it's really not their responsibility, are our equipment we use at the nurse's desk or the front desk or our own desk, like the phone or the mouse or the keyboard. And so those are just screaming with bacteria and germs, all right? So those are high-touch areas. So if we're caring for someone, or if we know we have an outbreak on a station, which I know, happens every year to some degree, then we got to make sure we're paying attention to those high-touch areas that everybody's using. We'll put them in a single room if possible to isolate them, and once they past symptoms and signs and symptoms of having it, we'll take it off. Droplet precautions, now we're talking about influenza, so spread through the air, okay? So it's not airborne, it means it's getting sprayed into the air, okay? Like you saw with the sneezing video. So they're generated typically by coughing, sneezing, even talking to someone. You know, you've done that, right? You just talk to someone and you get spit in the face, kind of thing. You know, they don't mean to do it. Pertussis, that's another one that's coming up on the rise anymore. Whooping cough. Pertussis is whooping cough. So we're seeing more and more cases of that too. That is also droplet precautions. And then bacterial meningitis, which can be pretty deadly. So we're now going to wear a mask when we go into the room. We're still going to do the high touch areas, but we're also going to help our residents understand that they need to practice good hand hygiene and cough etiquette. So if they've got a cough or maybe a cold, we should be putting a mask on them as well when they go out to eat in the dining area, or if they're traveling to the bistro or whatever the case may be, so we can help them protect themselves and others. Equipment, I talked about that. I always feel like that goes better. But the other things, that when state surveyors come, they really focus on certain things. Are we disinfecting them? One of those things are blood glucose monitors. We have a very specific protocol on how we clean those between residents. Bedside tables is another one. Are we cleaning those on a regular basis? Bath chairs, and so you can see the list from there. Mechanical lifts. They're going to be looking for, are we practicing good infection control with those items? If someone is on isolation, then you're going to see a red bag on their, one of those, it almost looks like you can put shoes in it, but it's going to have all the PPE in it that we need to enter that room, and there's going to be a sign on it. It doesn't look like this one, but it's going to tell us what kind of precautions we have to practice so we know. And so where we need your help the most is when we have visitors and family here. So here's something I've heard on occasion, and even my own work history, is someone comes to visit someone who's on isolation, they have influenza, and so I stop them and explain, actually we really need to have you put on a gown and a mask. Oh, I don't get the flu. I won't get the flu. And I'm thinking to myself, I'm not worried about you. Okay, right? So then I explain, of course, that when you come out, you're going to have it on you. So we need to help them understand that the reason you need to wear it is because you may spread it to other people. It may get on your clothing, it may get on your person. And remember, again, hand washing, 80%. We can prevent 80%. So clean hands do save lives. Any questions? Thanks, everybody.